All right. This young lady right here is saying she has balance issues and she falls sometimes. What do you see?
Yeah, she does have balance issues.
Hmm.
I'm going to assume also that she probably does get in the water a bit, having the swimsuit. I could be wrong, but she's stronger than not. Her hips are strong, but too tight, and that's her balance issue. So she has an anterior pelvic tilt, and she doesn't have quite a traditional sway back. She has a rotation. And I say that because if you look at the picture to the other side, her complementary bookend, you see how we can see the left leg popping behind the right there, right? That's her right. And then the one behind it, you see how we can see it. We can literally see it. So
Yeah.
that lets you know there's a rotation straight away. And that shows in the feet. And
Yeah.
everybody can go look in a mirror and look for that, right? If you take some pictures and you're like, wow, it looks like one leg is more hyperextended or rotated behind the other,
Yeah.
it probably is. This woman's also has a valgus knee, a bit.
Knock knee.
Knock knee. I don't like that word personally because it has such a yuck. But yeah, she's born with a valgus knee, which means her inner thighs are weaker than the average bear. And that's strictly if you drew a line from the bone, the inside of that leg bone to the outside,
Yeah.
it's longer and shorter, like we get into isosceles triangles or things like that. Those angles change and affects the muscles. So we always want to give her that inner thigh, and that's what's going to float her back. That's it. Like she just needs some inner thighs. She needs to do the ankle sequence.
Yeah.
So you could talk with this young lady about doing that because her quads are tight. Her psoas is tight. Like a standing quad stretch would help this lady so much because she'd have to stand on one leg and then she'd have to bring the leg behind her to stretch it. This is a beautiful strengthening. This is a straight up PT. And if she sat in a chair for us and started to do this, we would have to say the alignment must be impeccable because her kneecap's not going to go straight. However, she doesn't have a knee problem. So we don't really need to rehab that as much as we need to stretch it.
Right.
So imagine that muscle is tight and now she uses it to help her stand up. So she contracts in the quads, which is why you see her kind of, it's almost like she's crouching forward just a little bit, like she's going to jump, but she's not, which is a strong, ready pelvis. Again, talking about athletes, but she's in an older lifestyle. The muscle tone is lower. You can see it through the feet. So her potential here, like we just need to get the pelvis and the femur talking together and she's going to be great. It
Yeah,
sounds
because look,
funny.
her feet are not bad at all.
No, she's got a rotation and tight quads. So again, if we look at this muscle that you brought up for us and look at that muscle, it's a tight / dysfunctional quad. Specifically her vasti medialis oblique or her VMO. They're the ones that pull up the kneecap and make it straight. And then her inner thighs are going to activate and then her feet will straighten up. But they might not touch because if she's valgus or knock-kneed, that's not going to happen.
So the left hip is rotated, right? We
Yeah.
see that here.
Mhm.
And look at the windows, the arm windows.
And we've talked about this before, and the ladies out there can probably understand this. When you're knock-kneed, especially an older lady who's been told to stand with her feet together, you know, there's cotillion and things that we have learned to be ladies, right? Keeping your feet together is something a lady learns. And when you have a valgus knee, your feet cannot touch. So most people are going to shift and put one knee behind the other. Traditionally, it's the left leg and the right leg. That lets those valgus bones overlap and then they can touch their legs together. But it creates a spiral for a long time. And we're going to see this again. So if you're someone out there who's knock-kneed and someone said, put your feet together, you try it, you're going to overlap a leg. You can't do it. So we compensate.
Do you think this crease tells any signs at all or no?
Yeah. I mean, well, one, it tells us she's got some strength. It also tells us she's working very hard. But again, if we always look at the lines, right? So her anterior tilt, and she's moving forward just a little bit. So what she does in her body is she squeezes her shoulder blades, and that keeps her from falling on her face and gives her what many people think shoulders back. But it's not, because you can see her arms, her hands don't go with her. So it's a compensation. Because if she lets go of that, she's going to have a really rounded front. And then we're going to get something different, which will be knee problems. Right now,
Yeah, we can see
right?
her hands. Her hands are,
Yeah,
see her
it's a
hands right from the
really
front.
pure rotation. So the right leg has a tighter psoas, I'm going to suspect. You can almost see the external rotation is sort of still present the way she's standing, right? It goes zigzag. And thinking about that, the left one is stacked better. That's why I think it's the one that goes behind the right. And then she would squeeze her bum, suck in her abs, squeeze her shoulder blades, and stand. But that doesn't help her move, right? And she wants to get moving.
I see some progressive supine in her future.
Oh, hallelujah, yes, sir. But like an ankle sequence will be a way to help her rehabilitate these quads, the quads and the psoas, and
Yeah.
get her feet underneath her. And it will be one of those, oh my goodness, what happened? Because she's really close to being functional. I
Right.
love that. That had nothing to do with her age either. She just has a rotation, but she's
Right.
strong, right? You can see that. So her right one is tighter.
Yeah.
Probably. You might come back to me after talking with her and going, it was the left. And that's okay. I have a feeling the left is more functional, not necessarily more articulate, right? So I'm
Yeah.
just saying it looks more like stand on the left, do on the right. A lot of people do this. It's a great thing to understand this muscle. Hard to palpate, very deep. So if you go looking for this muscle, it's under your ovaries, it's under your intestines, it's under your organs. So you
Yeah.
need to dig deep. And if it really hurts, you kind of feel yourself gliding in there and you will find it. And if you lay on your back and you have a large arch in your back, that also is an indicator that your psoas doesn't release into gravity. We're always going to be talking about gravity.
It's such a major muscle, you know.
Well,
See
it
it in
helps
my
you
hands.
crawl when you're young.
Yeah.
It helps you sit up when you're young. And
Now,
then it
do
helps you walk.
now we like to have older folks, seniors, crawl too,
Yeah.
and that could be a great way to build strength for her too.
And if you're going right now, oh no, not my knees, you actually don't have to move across the room to stimulate the muscle groups. We can find a comfy way to do it. Do you know babies don't have kneecaps when they're born?
Yeah.
Yeah, that's why they're good crawlers.
Right.
Just this weird science thing. And then as we use these muscles correctly, that patella is like an oyster, you know, making a pearl. Through
Yeah.
proper use, we kind of grow this sesamoid bone called the patella, but it starts off as a little nugget of cartilage. And so when you think about the development, she's actually got great poise above her waistline. It's artificial, but she's got it. Like, you know, I don't know if you can see what I mean, but the shoulder is in a better place than not. Her hips are just rotated.
Yeah, we can see one ear is higher than the other, so a little neck.
That's going to be the left side. Right. So if you rotate your body, one side sticks up and one side goes round, that would fit what you've described for her.
Yeah.
Yeah. She actually needs more upper body strength. It's a weird way of thinking about it, but she's really good at retraction. I suspect she's not good at protraction. So we want to balance that.
Right.
But she's working with tone, right? She's, I don't know what her age is, but she's definitely, well, here's the way to sometimes look at it, and I know ladies can understand. Everywhere on this woman where there's not a lot of tone are the muscles that aren't working right. Right? It's the back of her legs, across the bottom of her bum, and her thighs. And a lot of us ladies are like, oh, I just have my mother's legs. Oh, I have my grandmother's legs. I just inherited them. Yes. And we can do something about that. Just because you're born with a valgus knee and a rotation doesn't mean that you can't be striving for perfect tone and balance. But as a woman, we might understand that. I always like to tell that to women when they're like, oh, I have this piece of saddlebag that just never leaves. And I'm like, well, it's your posture. How can that muscle work if you don't put it on the right frame? And
Right.
I think that's really hopeful, because all of a sudden you're like, oh my gosh, I don't need liposuction and I don't need all these things to fix me. It's like, no, no, no. You just need to do your menu.
That's
That's
right.
it.
Do the
Because she'll change.
protocol
Yeah, do the
two
protocol, do
times a
the
day.
menu.
Let's go.
Yeah.
All right. Well, we can get her all corrected. So, and that's
Yeah, I would
exactly
love
what
to
we'll do.
see.